Hello, people. I'm Dr. Mia. I have a question for you. Do you know our new or fake, right? You already know. We already know before Donald Trump told you. But you also know our medical system is fake too. I bet. You probably shocked. But if you listen to my video, you wouldn't be shocked. Our medical system is symptom relief care, controlling what you have, temporary. And then, so if you have infection by bacteria, treat with antibiotic, you feel better. But next time when you have another infection, they come back with a vengeance. Same thing with flu, antiviral drug. If you take Tamiflu, you feel better for a few days, but then the symptom come back and you get sick more often. So is that really healthcare? What is healthcare? I know I did not learn about health in medical school. Healthcare is what for you? What is health for you? What is real health or fake healthcare? Fake healthcare is you chemical to manipulate your body to feel better, and you think it's healthcare, but actually it's not. Just relieve the symptom, temporary relief, and you think you're better, and it's not. So that I call fake healthcare. In medical school, they only taught us you chemical to manipulate your body, you feel different, and you think you heal, but actually you are not feeling better, and you're sick. I walk around and see people sick all the time, but I cannot say, hey, your skin kind of pale, your skin kind of yellow, you don't look good. But people don't know. They still function, they don't feel well, they're not happy, but they go to doctor and give them medication so they feel better. But hypertension medication, you even addicted to hypertension medications, let alone opioid addiction. So my question is, what is most dangerous place to walk in? No, not McDonald's. Hospital. And who work in the hospital? Doctor, nurses. Based on Center of Disease Control, 700, 800,000 people killed per year in the United States of America by doctor for mistake that they did to you. But if you have cancer and they treat you with chemical therapy, chemo, and you die, that is not in the statistic. CDC only report when doctor mistake. Do you know how many they would report if they make mistake? People don't report mistake when they do, only when they cannot cover. So based on every 3 mistakes, they report 1. Almost 3 million people die in this country per year. Where do they die? Not on the street, not at home. Well, they do, but very little. Hospital. And that's where, and counter to the nurse and doctors in the hospital is more dangerous than drive by the hood to get some cracked. Yet, because only 33 million people die per year on murder. How about the second most dangerous place to walk in? 30 seconds to guess. Doctor's office. Yes, you're right. Doctor office. Who also work there? Doctor and nurses. Very dangerous to walk in doctor office. Because walking in a doctor office, you walk out with what? You walk out with prescriptions to get medication. You walk out with a lab test, tell you that your body not well. I would not pay people to tell me that my body is not doing well. I don't know. Most of us are very stupid, not me. I would not go to doctor. I haven't done a blood test for a long, long time, over 20 years. I don't go to doctor, so they don't have to tell me what's wrong with me. because I'm a health consultant, so I teach people how to take care of their body. You do have bad days and good days, but you embrace nature is the best way to go for your body. So how about the third place that's very dangerous to walk in? Third, pharmacy. Based on prescription drugs that people kill, opioid addiction, prescription drugs, that's where you get your poison. Not McDonald's, not Burger King. Even though McDonald's, Burger King, you know is bad for you, I'm okay with that. You smoking, you know bad for you, I'm okay with that too. You have unprotected sex, I'm okay with that too. But I hate when people pretend to help you and yet they hurt you. That's doctor and pharmaceutical company. So third place to walk. How about fourth place? Very dangerous to walk in. You probably very surprised when I tell you. Dentist office. 50% of the opioid addiction came from dental's office. Dentists prescribe very powerful opioid after they work on your teeth because they don't want you to bother them. So they give you a very strong opioid medication and you're addicted to it. And you cannot get it, where do you go? The street. Yep, very dangerous. People don't know that, huh? So the few places that people think is very safe to go in, but it's not. So that's I call fake healthcare. So the best way to take care of your body, again, nutrition, herbs, good emotion, good air, clean water, good spiritual intelligence, CBD if you have to, THC, hemp oil. I mentioned again that medical school, they never taught us THC pathway. They taught us everything opioid pathway, how protein metabolize, how carbohydrate metabolize, becomes simple sugar, protein metabolize, become simple amino acids so your body can digest it, how fat metabolize, and yet they don't teach us THC because they don't want the doctor to know the benefit of THC marijuana. Otherwise, doctor office cannot make money from patient to pay back their tuition. Doctor owe $500,000 now if you finish medical school. So what do you do to make the money back? Diagnosis. The more diagnosis you have, more money you get. How about dentists? Dentists owe almost $400,000 for your 28 teeth, unfortunately, because your 4 wisdom teeth have been removed. And that's why most of us don't have wisdom anymore. Okay, people? I'm Dr. Mia. My focus is on embrace nature. I do everything naturally, all medical condition, you nutrition to treat you. And if you need any help, contact me at grandmamedicine.net. Love nature and nature will love you back. Until next time, to good death.